Thank you, Cameron. I will walk you through how Business for Health Solutions increases healthcare access in Africa by building local private sector supply chain. I'll talk a little bit more about our collaboration with Merck. So who we are basically has been mentioned a bit before. We seek to develop a sustainable African healthcare industry. We focus on improving quality, affordability, and accessibility to healthcare products and services to our patients and their communities. We do this by strengthening the local private sector supply chain. This is all done remotely, facilitating through technical assistance projects using highly skilled corporate volunteers. And our projects really seek to touch base on key SDGs as mentioned prior by Didier. We look at the good health and well-being. Overall, we touch on decent work and economic growth. We look at industry innovation and infrastructure through the projects, and through our partnerships, we seek to find common goals moving forward. How we come about is we look at the private sector itself, and we know that a lot of the public health sector is the one which gets the majority of initiatives locally in Africa, and so we want to see to bridge the gap on the neglect in the private sector. Together, we identify the gaps with enterprises that are private. We seek to see areas where there's capacity constraints, and we see how we can address this remotely using the BHS model that I will talk about a little bit more forward. All this is demand driven, and the healthcare enterprises are the ones who specify their needs. And these needs are also brought forth to the corporate experts. And through their virtual skills-based volunteering, we support the management of the projects, and we measure the impact using our model. Of course, we have various areas in the healthcare value chain, and we seek to create impact wherever we can. Looking at production, distribution, this is a great area that we've worked closely together with Merck. We also look into service providers. We seek to look at other payees, intermediary projects, but overall seeking to improve points at the healthcare value chain. How we work, we'll talk a little bit about our project cycle. We look at 4 areas. That is, we seek to connect. That is, we identify the local enterprise. We identify their needs together with them. We then match them with the right volunteer, with the expert skills, and we seek to scope a project together. And we supply a way of facilitating the project goals, identifying the timelines, what would be our success metrics once the project begins and ends, and also at the end of the day, see how we can connect and create a channel of success by measuring the impact that we've created from the beginning to the end of our project. So this is our general life cycle for our model. So how do we create value? We create value through 4 main pillars. The BHS clients themselves get to have capacity building through their employees gaining skills. We manage to solve business challenges together, and we support their business growth. For the volunteers, they gain skills and competencies by engaging in projects that are different from what they might be doing on a day-to-day. They also may end up having personal satisfaction just through the volunteer experience itself. Looking at the corporate partners, they often seek to see their employees engaged in activities that are broadening their perspective, that can bring now even a fresher input into the work that they bring into the corporate world. And also we have look at the management process. I mean, the volunteers end up managing projects that are a wider base, and you get to have an insight into the African market share. In our communities, we end up having increased healthcare access, which at the end of the day is our goal, and that is where we want to go. So looking at our framework, how we look at impact and how we seek to achieve it, we begin with activities themselves. As we mentioned prior, these are all technical assistance projects. We are connecting with the industry experts and the healthcare experts, and we address the deep technical business needs. We look at the outputs. we see, have we increased or created an improvement in the product or services being provided by the client? We also acknowledge staff being supported through increase in knowledge and skills. Then we look at the outcome. How many individuals have increased access or have had their improvement in products and services? We then overall now seek, with evidence, scientific evidence, the reduced morbidity or mortality in key demographics. Some of the areas that we've focused on from our pilot and initial projects include newborn, child, adolescent, mothers, and adults, and non-communicable disease focus. Talking a little bit about our partnership with Merck, DDA has touched on a bit on the different projects that we've worked on, but overall, we've worked with 27 experts in the last 1.5 years through the supply chain. And we've had investment of over 250 hours through the remote assistance support. We've had 7 projects which have either been completed or are still in progress, and we've supported 6 enterprises to improve their operations. I'll talk a little bit more about one particular one. And we have been working closely with Merck in 2 countries of Tanzania and Ghana. Our supply chain focus has been in 3 areas of inventory management, where we've been optimizing stock levels, looking at how we can improve delivery times and reduce the stockouts, and also look at how we can reduce product expiration. We also have been looking in the area of procurement practices and vendor management, that is improving timelessness and quality of the supply. And also we've been looking at the 3rd area of demand planning and forecasting, where we've looked at clients or worked with clients who are focused on as distributors, local drug manufacturers, and also as hospitals. Our impact, after looking at the market share from the clients that we've worked with, has improved healthcare access for over 1 million people based on our estimates. And this includes looking at the areas of increased availability for the essential medicines for key burdens of diseases, such as pneumonia and malaria. So I'll go into focus with one particular project that we've been working on for 9 months, which has contributed close to half of the technical hours assistance mentioned prior. This is with the Tanzanian distributor, who is locally owned and has a wide market share in the country. They are requested for assistance around inventory management processes. What we did is connect them with 4 supply chain experts from Merck, and we supported them through 28 remote connections over a 9-month period, where they contributed 130 hours of technical assistance. The areas that they supported improvement in was, as mentioned prior with DDA as well, areas in forecasting tools, improving the accuracy of a product-specific demand for demand planning. And also we've looked at improvement in their inventory management processes. We supported them in modifying their methods for product costing, and we also assisted them to improve in their planning for their automated consignment and inventory monitoring, which they will soon initiate. So at the end of this project, we have results that were measurable. What we noticed was that we have created a reduction of 40% in the delivery time, and we have also created an increase in quality of purchase by 36%. Starting with a baseline of 90%, inventory accuracy has improved to 98%, and we have created 0 product expiration in the stock and expiry dates. So overall, BHS will continue to serve through collaborations such as Merck, with the one we have with Merck, and we are creating impact slowly through the projects that we conduct. And through this forum, we hope that we can create even more awareness about the opportunities that we have in creating impact by using virtual modalities, and how we can really link with the world and bring the global aspect even closer to home. So briefly, I would like to end here, Cameron, and welcome you back. Thank you very much.